Hello everyone. Let's discuss about a few clinical questions related to physiology. So in this video, you will be seeing 5 scenarios related to physiology-based clinical questions. So let's get started. First scenario 1. Now, the length of the question is very big, but don't let you fool that. So the questions might be this lengthy, but the answers can be very simple, right? So these questions are given in such a way to make sure that we are tough enough to answer any situation or any clinical based question. So starting with the scenario 1, a 20-year-old woman met with a car accident. Fortunately, she did not sustain major injuries. A neurologist in the emergency department comes over to check the woman. He asks the woman her name, but the woman is unable to respond back. The neurologist also asked how is she feeling. She was not able to respond to that either. But when the neurologist asked her to shake her head if she understood what he is asking her, she shook her head properly and immediately. And the neurologist also observed that she is able to make noises and sounds that didn't form any meaning. So now you are an aspiring intern in the emergency department. The neurologist calls you and asks you what is the possible problem with the patient. What will you say? So here let's look at the key points, right? First, she meets with the car accident, and then when the neurologist asks her name, she's not able to utter it. But when the neurologist asks her whether she's able to understand what we speak, yes, she is able to speak. So the problem here is with the motor activity of the mouth, lips, and the vocal cord. Vocal cord. So she's not able to create her own sentences. So that means there is a high chance that Broca's areas of her brain is affected here. So the loss of Broca's area causes motor aphasia, which is loss of speech, right? So the skilled motor patterns for control of the larynx, lips, mouth, respiratory system, and everything is dependent on the Broca's area. And that part is affected for her because of the car accident. And that is why she presented with those kind of signs in the clinic. Now, moving on to the next scenario, a 12-year-old boy hurts his lips while playing in the park. His parents bring him to your clinic for treatment. After observing the boy, you come to a conclusion that the boy needs stitches in under his lips as the wound is so deep. For performing the procedure, you ask the staff nurse to bring a dash that will help the boy feel less pain when you apply stitches under his lips. Now, explain what will the staff nurse bring, explain how will you apply it, and explain how the process works. So see, we have a 12-year-old boy who got himself hurt under his lips, and the wound is pretty deep, so you have to put stitches. And to make sure he doesn't feel any pain during the stitches, you have to put something there so that there is less pain. So I guess everyone knows the answer for it. It is anesthetics, right? Local anesthetics. So the nurse is going to bring local anesthetics like lidocaine, procaine to put it as an injection there so that the boy feels less pain. But now they're also asking how will you apply it and explain how the process works. So we have to explain how the process works. So basically, this local anesthetic, what it's going to do is it is going to reduce the membrane excitability. Okay, it is going to reduce the membrane excitability by inhibiting the activation gates of the sodium channels. So the opening of the activation gates of sodium channels will become tough now. And because of that, depolarization won't be there and hence excitability won't be there. So the pain nerve impulses won't be transferred, right? So that is how a local anesthetic like procaine, tetracaine, and lidocaine act. Now, moving on to scenario 3. Let's look at this. A 50-year-old man is suspected to have a lesion in his brain. The neurologist orders an MRI to confirm the same. The MRI results supported that there was a lesion in the patient's brain, but the MRI did not give the doctor a clear idea where the lesion was located in the brain. Like it was depicting, but it did not give the doctor a clear idea. Hence, the doctor decided to give a simple activity to the patient. In this activity, the patient was asked to draw a clock and an object by looking at a picture of the clock and the object. Here's how the drawing turned out to be. So this was the actual drawing which they gave to him. This was what the patient drew. So now as an aspiring neurosurgeon, you are requested to explain and give your diagnosis for this case. So look at this diagram here. He is missing the entire left side, right? The left side of the clock is not there. And even the flower, the left side of the flower and the plant, the leaves, nothing is there. So basically, he's missing one side of the drawings. He's not focusing on one side of the drawing at all. So this is something related to spatial coordination. He's not having enough awareness about the left-sided things. So let's look at what is the solution for this scenario. So lesion in the posterior parietal cortex, which is the location for spatial coordination for motor control of the body. So we have a lesion in the posterior parietal cortex. So in this posterior parietal cortex is the location where you have spatial coordinations for motor control of the body. Since there is a lesion here, he is not able to spatially coordinate the left sides of an object, so he is not able to copy them in a paper. So let's a little bit more details about this case. Lesions of the posterior parietal cortex produce an inability to perceive objects accurately through normal functioning sensory mechanisms. So this condition is called as agnosia, the inability to perceive objects accurately due to lack of spatial coordination in motor control. Right? Now look at a diagram where the posterior parietal cortex is. So the lesion can be here anywhere for the patient. We are not going to go into the details of it because we're focusing on first year level. So in the posterior parietal cortex, the patient might have lesions. And again, some more details to add to this. In these cases, the patient's ability to copy the left side of the drawing is severely impaired. Also, such a person will always try to avoid using his or her left arm, hand, or other portions of the body to perform tasks. The person may not even watch this side of the body. So this is called as personal neglect syndrome. Okay, when it is worse, this is called as personal neglect syndrome. They almost not know that the other side of the body does not exist. They do not acknowledge that at all. Now, scenario 4. This is a really interesting scenario, one of my personal favorites. Let's read it. A patient walked into your mini clinic after visiting a huge super specialty hospital. He says that he visited that hospital for consulting a neurologist. When asked what made him come to this clinic, he says that I am afraid they diagnosed me wrong in that hospital and I wanted to get a second opinion from you. He shows you his report from the super specialty hospital. Here are the details of the report. Patient has rigidity of muscles, involuntary tremor at a fixed rate of 3 to 6 cycles per second of the rigid muscles, even when the person is resting, serious difficulty in initiating movements, poor balance and falls, and dysphagia. Dysphagia is inability to swallow objects, swallow food. Now, what do you think was the diagnosis of the previous hospital, and do you think it is correct? Now, we have a patient who went to a super specialty hospital, right? But he wants a second consultation from you, from us. So he has come to us and he shows us this report. Now, I've not put the diagnosis of the report here. I've just put the findings of the patient here. So now with this, we have to say whether what the diagnosis was from the previous hospital and was the diagnosis correct. So the diagnosis is Parkinson's disease and the diagnosis is correct because these are all the features of Parkinson's disease. So see, Parkinson's disease. Some patients in Parkinson's disease can also have speech disorders, gait disturbances, and fatigue along with Parkinson's disease. Now, gait disturbances is something that the way you walk, the posture when you walk, that is called gait disturbances. That postures are disturbed here. Now, the final scenario, scenario 5, a simple one, but a little complex one because this is fact-based. A woman aged about 37 presents with a complaint of flicking movements in individual muscles of her body for the past 1 month. She's accompanied by her son. Her son tells you that his mom also keeps forgetting a lot of things recently. What do you think is the problem here? So the clue here, it is a genetic disease. And the keywords are flicking movements and then dementia because the mom forgets things, no? So if you would have gone through some genetic part, this disease is nothing but the Huntington's disease. It is an autosomal dominant. It starts with flicking of individual muscles and then leads to motor dysfunction along with dementia. Now here's a list of facts about Huntington's disease that I've put for your reference. You can pause this video and take a look at it. And this is the third discussion video I'm doing. So as a reminder, I would like to tell you, before I give the solution, you can pause the video for a second and think about the solution for your own. So that let's see how you are thinking and let's see how the solution is, so that you can compare and approach the next question even more better. So I hope this session really helped. We will consistently bring you more clinical questions, and I'll see you in the next one.